Welcome to Season 8 of the Lighting Your Way podcast. Hi, I'm Betty Long, your host, and this season we are giving the microphone to those who matter most, our patients. Join us as they share their personal journeys, offering candid insights into their experiences, challenge, and triumphs. This week, we are happy to turn the tables a bit and talk with my Guardian Nurses colleague, Andrea Spector, who has been a nurse for more than 40 years. Last year, Andrea was diagnosed with diabetes 1.5, or LADA, which is an acronym meaning latent autoimmune diabetes in adults, LADA. Unlike type 1 or type 2 diabetes, LADA is a unique hybrid, typically diagnosed in adults and sharing traits of both major types. Many people with LADA are initially misdiagnosed as having type 2 diabetes, which can lead to ineffective treatment. In this episode, we will hear from Andrea about her own journey, including her early symptoms, eventual diagnosis, and because she's aware of what uncontrolled diabetes can do, her motivation to lessen her risk of the potentially devastating complications. Welcome to the podcast, Andrea Spector. Welcome back. It's always good to have you as a guest, this time as a patient.
Thank you, Betty. I'm happy to be back.
Are you really as a patient? I don't.
Not as a patient, but that's okay. I have a lot to say, so it's all good.
So this season, as you know, we are talking with our patients, and I guess it was maybe a week or two ago, I had read an article about this new, well, not this new, but the new diagnosis of diabetes 1.5, which is new, relatively new in the medical world. And you responded and said, "That's me." And I thought, oh, there's an opportunity to talk with Andrea as a patient. So thank you for joining us to talk about that and your experience. So why don't you give us a little history as to your recent diagnosis?
Okay, thank you, Betty. So I have always really been rather healthy, kind of took my good health for granted, never really thought that much about it. I just kind of went on with my life and was, again, like I say, I really didn't have anything major going on. And about a year ago, and I might say that at the age of 63, about a year ago, I started to notice in like September that my eyesight was getting blurrier. And I am a bit nearsighted. I generally wear one contact lens in my right eye for my nearsightedness, and I can see close in my left eye. And all of a sudden, I was having trouble seeing. And it was over a period of about just like 3 or 4 weeks, maybe. I'm like, I'm really having trouble seeing. And it was getting worse and worse. And I started actually putting a contact lens into my left eye as well, trying to, just try to improve my vision. And I would mention it to people like, I don't know, I'm not seeing well. Mm-hmm. But I also started to notice that I was incredibly thirsty. Mm-hmm. And I had this dull headache. And I finally decided that I either had diabetes or a brain tumor. And
okay.
So I decided that was the nurse in me that decided that.
That's always a bad thing when you know too much, right?
But I also was always that person who was like, yeah, it'll go away. And this threw me. It really did start to disturb me. So I decided to start the route of the eye doctor, and I went and had my eyes exam. My vision exam done, and the doctor, she said, first of all, my prescription doubled.
Wow!
And
yikes!
Yeah, but everything else was fine. My retina looked fine. The pressure was fine. She's like, "There's nothing wrong with your eyes, but your except for your prescription." And she said, "You need to go get your blood drawn." So the next morning, I went to the lab and did a fasting blood test, and I did get the results back the following morning when I woke up, and I was actually shocked. My fasting blood sugar, which should be between 70 and 100, was 325.
Wow.
And my A1C, which normal A1C is under 5.6, was 10.5.
Wow, Andrea. Oh, jeez. Wow.
And you know, I looked at the values. I'm like, oh my God, like deep down, Betty, I knew that it was going to be. I knew what I had, but I thought maybe an 8. You know, and even my primary doctor said that to me. She goes, when I had sent her the first message that I need to get my bloods drawn, she said that's what she was thinking. But 10.5, what I learned from the endocrinologist is that I probably was walking around with an average blood sugar of 250 for at least 3 months.
Wow.
Yeah. So I sent a message to my doctor first thing that morning. I see my labs. What do I do now? And they actually got me into an endocrinologist that day. So later that day, I went to the endocrinologist, and that's when my whole life kind of changed.
Wow.
He stuck one of those continuous glucose monitors on my arm and gave me my first dose of long-acting insulin and started me on medications. But he also said to me at that time, I was thin, I exercised intermittently, I ate well, or so I thought. I've learned otherwise, but I did eat fairly healthy. I had no risk factors whatsoever. So he did say to me at that time that you might have autoimmune diabetes, which translated into type 1 diabetes rather than type 2, which is what most adults, you know, is considered adult onset.
Okay.
And that's when my journey started. And within this year, through the process of ending up on a short-acting insulin with my meals, total dietary changes, and trying to work that into my life, I ended up starting in June on an insulin pump. So I always have this pump attached to me, giving me the insulin as I need it. You know, I program in the carbohydrates that I eat, so that I can get the right amount of insulin. And it also, the pump does adjust for what my blood sugar is, if it's low, if it's high. So there's what they call basal. So it's always giving me a little insulin, but it'll stop and start it based on what my continuous glucose monitor is telling it.
So this has been quite a year for you, and because you're a nurse, I think you had quite a head start in understanding what diabetes is and why it's so important to eat right and be mindful, I guess, of what you're eating, and also exercise and get insulin, right? So, but tell me why. So after you started on the insulin, did your vision clear up? And did the thirst go away? Like all the symptoms that you'd had, did they go away?
Yes, it took a while. My vision within 3 months, my vision was pretty much back. You know, I waited because at that time when I saw the eye doctor and my prescription had doubled, I couldn't see, and so I had ordered glasses and contact lenses and, you know, the whole 9 yards. And then as it started to go back, none of that was good anymore either. Thank God for 1-800-CONTACT. Not to be like a commercial, but they are amazing about exchanging and whatever. But yeah, my vision did go back, and that, you know, I did, you know, lose those symptoms. But it was interesting because, like you say, as a nurse, as a nurse, in my pediatric years, I worked at a sleepaway camp and had 24-hour caring for young diabetics, and in school, I worked in a school, and I took care, there were the diabetic students, and so I had experience. And it was interesting when I went to this endocrinologist, he said to me, "You're a nurse," and I was like, "Yeah," So I said I've worked with diabetic patients. And through our work at Guardian Nurses, we work with the diabetic patients. But I went and I'm like, okay, I got this. And I went home and I sat down and I was like, I know nothing. All I can think is
Right.
that I really don't know anything. And so, of course, I started reading, because at that point he did order more labs to see if it was an autoimmune type 1 rather than the general adult onset type 2.
Okay. Well, and that's what I think when the type 2 is adult onset, but it's mostly because of obesity, inactivity, right, and a diet high in carbs, and that's not you, right? So I can imagine that you were. I mean, did you have any, like, between kind of knowing in your in your heart, I guess, that you had diabetes with the increased thirst and the headache and right the vision changes? Did you have any kind of like difficulty wrapping your head around, like, I have diabetes? Like, wait a minute.
Yes, and to this day I do. There are just times where I'm like, I can't believe that I have this, and this is one of the. I can't believe I'm walking around with an insulin pump, attached to me.
Right.
And I did, I have to say that there were a few calls that I made, the first few calls I made, and one of them was to one of our Guardian Nurse colleagues, Janine, who is like our diabetes guru. So she, of course, was one of my first calls. Because, and I think that's one of the things that I really want to bring out to people is that, when it becomes you, it's different. We always say that with our patients, like once you hear something, you kind of almost shut down. And that was why when I got home that night, I was like, oh my God, like I can't believe that this is me.
Right.
And that I'm entering this. This is going to be lifelong.
Right.
But I would like to add at this moment that I also am very grateful, because there are a lot of diseases and disease processes that you can't have any control over. That so my body has decided to kill all my my insulin creating cells in my pancreas, but I have some control over this. So this may be lifelong for me, but I'm grateful that it's this and not something else. But the other thing is that I will say that being a nurse and knowing about diabetes, my biggest fear was all the things that I know diabetes can cause in the long run.
Right.
And that's what does drive me is I don't want to have cardiovascular disease. I don't want to lose my toes. I don't want to lose my eyesight. I don't, so I'm really, that's one of the things that I always have trouble wrapping my mind around.
So the motivation, because you're a nurse and you know what the complications can be if you don't control your blood sugar, has really stepped up your motivation. Is that what you're saying?
Yes.
Yeah. So, Andrea, what's when I talked about the diabetes 1.5, right? What's the difference between 1.5 and 1 or 2? Why have the medical world created this new diabetes diagnosis?
So historically, diabetes was divided. Before it was called type 1 and type 2, it was juvenile onset and adult onset. And it was the kids, the young kids, that got what we call type 1 today, which is insulin dependent.
Okay.
Type 2 diabetes is not insulin dependent. It's an insulin resistance issue, and which is the reason why a lot of type 2 diabetics, they never need to be on insulin because their body's making insulin. It's just that there's a resistance. So the medications, the oral medications, some of the injectables now can control that for them. But a type 1 diabetic is not making insulin, and it's an autoimmune process because it's my body that fought against my cells. So people with type 1 diabetes is always considered the kids, the young kids, the teenagers, and as an adult you got type 2 diabetes, which was like
Right.
what you were saying, but had the overweight and the bad diet and no exercise and those risk factors. So this is different. This is actually, they call it LADA, latent autoimmune diabetes of the adult.
Okay.
And so that, and immediately the endocrinologist, looking at me and looking at the situation, that was what he said, we need to do more blood work. And what they found is that I have the antibodies that are fighting my insulin cells. But a lot of times, as an adult will come in and they're going to be diagnosed as type 2, and they try to treat them as type 2, and nothing works. And that's when they first say, oh, well, maybe it's not type 2. And so they, then start doing all the other tests and realize that it's actually LADA. So now they kind of have this type 1.5, because it's not, if a young person gets type 1 diabetes, they go through a honeymoon period, but right away their blood sugars are very high. It comes on really quick. This is considered that it comes on slower. So they might be able to treat it as a type 2. And for a lot of people in the diagnosis, they say they can treat it as, they should be able to treat it as a type 2 for at least 6 months before somebody should become insulin dependent. And so that's why they stuck it in as this 1.5. But like my diagnosis in all my medical records is LADA.
Is LADA, okay. And did they offer any kind of reasoning for why this autoimmune happened to you? And your pancreas, like what was the theory?
Yeah. Well, probably, and this is all, this is not proven, but this is probable. I probably had the factors for autoimmune disease. I did not have any autoimmune diseases, as any diagnosis or anything, but there was something in my system that put me at risk for an autoimmune disease. And so the thought is that this was followed a virus, which in my case would have been COVID. So I had COVID in December of, let's see, so that I was diagnosed a year ago, so the December prior. And I wasn't feeling right for months. I really wasn't feeling that well. But I had my physical in May of that year, and my blood sugar on my, regular labs was 91, which was fine. But I did say to the doctor, I'm just not feeling right. I'm tired. I wasn't feeling right. She retested my thyroid, which was fine. And so that was it. It was like, who knows? So I probably was building up in my system. And for me, what kicked off my autoimmune response was probably COVID.
Oh. Is there do you have any kind of family history for diabetes at all?
No, we have no family history.
Wow.
At all for diabetes. And now, like my kids, I just said they have to tell that when they get medical care or they go for their physicals, because they could also be predisposed to autoimmune diseases, not necessarily diabetes and whatever, but whatever factor caused my body to start fighting against itself, which is really what it did, in attacking those cells.
So the diagnosis that the endocrinologist, in terms of the testing that he or she did, was blood work. Was there any other testing involved, or was it just blood work?
No, it was blood work. They looked for the antibodies, and then there were a few other factors. He had me do this lab work, and I, of course, I'm on Google looking them up because I had never, it's not routine lab, so I had never really really heard of that.
So I'm glad that you're feeling better, first of all. I'm glad that they
Thank you.
figured it out. But talk to me about, like, so did you, I hear you went on Google like everybody else did, like
Dr.
everybody
Google.
else. But Dr. Google. But did you, like, sometimes when I go to the doctors, I feel like a secret shopper. I don't tell anybody I'm a nurse because I want them to interact with me as a patient so that they don't assume I know things that I know. Did that happen to you at all, or did you kind of come right out? I mean, it sounds like you did with the endocrinologist saying about your experience at the camps and high schools, but.
Well, he asked me, interestingly, people probably don't, when you, and I see doctors in the NYU system, and so to get into my records, they have to, quote unquote, break the glass, because at one point I was an NYU employee. So he asked me right off the bat if I was a nurse. But okay. I, like you, very often will not say that until I feel like that somebody's wasting their time telling me some of the real granular stuff that I already know. Then sometimes I'll say, but I try not to say right away, also because I want to hear, but right down to the basics.
Correct.
Because there are things that I learned, that I've learned in the past year that I thought I knew all about diabetes, and I didn't. And so I didn't go right away to the diabetic educator, but ultimately I did. And I did go to the nutritionist. But what I finally learned is, because I really try to weigh and measure and eyeball, at least when I'm not home. But when I'm home, I try to weigh and measure my food, which I said I could never do. I was always like, I always wanted to lose that last 10 pounds of baby weight. Mind you, my baby next week will be 30, but I've always wanted to lose that.
Hope springs eternal. That's
right. And I was like, I should try Weight Watchers. I'm like, I cannot measure my food. And now I weigh and measure my food. But what I learned was that, I ate pretty healthy foods, but my portions were ridiculous. And that's here in the U.S., we just get big portions. My portions were ridiculous. The amount of carbs I was eating was crazy, because that's what I'd like to eat. So I've had to change my diet. I did lose the baby weight, mostly because I stopped eating dried fruit and really high sugar things that I love. So that's been tough. And, I'm not I'm not a great diabetic eater. I am, but I'm not.
What does that mean? What does that mean?
I sat in on an endocrine appointment with a patient last week, and it was a nurse practitioner, and she was wonderful. She was an educator, and she went through, I should, diabetic, you should eat 3 meals a day and 35 grams of carbs for this and that. And I can't do that. That's just not my lifestyle. I eat breakfast when I get to it, and I eat lunch in the middle of the afternoon and dinner late, and I'm on the road for work. And so, I'm not able to be that regimented and rigid. And the other thing is that when you take insulin for your meals, you're supposed to take it 15 minutes before you eat. Well, so there's no more walking by the kitchen and grabbing a snack. Okay. And I do find that difficult. A lot of times I don't know what I'm going to eat until the food is put in front of me. So I have a lot of problems with that timing. But I have to say that in all the years that I dealt with adolescents with diabetes, I always told them, and I tell people this all the time for everything, you don't, and especially with diabetes, because you can have some control over it, that you need to control your diabetes. Don't let it control you.
That's okay.
And
yep.
So that's what I am striving for. Is I have my lifestyle. I'm not a young kid, so it's hard to teach an old dog new tricks. I have my lifestyle, and so I'm trying to work to keep this under control, but but kind of under my terms,
Okay.
which
I mean,
sometimes works and sometimes doesn't.
Is that the biggest change, like in terms of being a nurse and interacting with patients who are diabetic? Has that given you more empathy being diagnosed yourself? How's it impacted your relationship with patients?
It has. I get it better. You know who it really impacted me is the parents of the kids who have diabetes, who have to deal with this every day with trying to, manage somebody else's life, with diabetes. But yeah, it opened my eyes. It's a whole different experience. And again, I thought I'm so knowledgeable. I know you just can't eat this and do this, and and
Right.
it isn't really like that. It's hard. And again, we see our patients who just weren't able to do it, or didn't have the level of education and the support to do it. And now, they're struggling with all those side effects. It's a scary thing what this does to your body.
Yeah. I mean, type 2 diabetes is certainly the scourge of the United States, just because of so many people, again, being inactive, being overweight, right? Not eating right, eating a lot of processed foods, right? Because of their jobs, right? Not able to sit down and have a meal, right? They grab something on the run. And that's certainly borne out in the fact that I think obesity is the number one public health epidemic, really, when you think about it, because it leads to so many other problems. So you're doing well now, right? And what would you like to say to providers as a patient, not as you, Andrea Spector, a nurse? Because it sounds like you went to your primary, you jumped on it, you got an amazing appointment with an endocrinologist in a very timely manner. You saw a diabetic educator. You went to a nutritionist. You did all the right things as a patient. Who was that you coaching yourself?
Partially, yes. I think that, and I'm okay, with my group, and the fact that I went on the pump created a much more of a back and forth conversation. And I do use my chart, so I do communicate via messages and so on and so forth. But a lot of people don't necessarily do that, and you can't these days. It's very hard to call a doctor and speak to a doctor. And not speak to a machine before you can finally speak to someone who's not a doctor. But I do, I don't, like, I feel like there was a lot of interest when I decided, I knew I needed the pump. Because I'm a nurse, I was able to kind of negotiate my care a little bit better. And so I just think, like I say, that appointment I went to last week was so amazing, because this nurse practitioner, she explained everything, and that providers these days don't always have the time or take the time to really explain what could happen down the line, why you need to do this, and this is what you need to do. That people don't get the education that to really explain, this is what you need to do. You need to measure your food. You need not to eat something else, or you need that exercise, even if it's a 10-minute walk every day. And again, this is a lifelong situation. Like, I will be insulin dependent my entire life. And there are people who, I was diagnosed at age 63, and hopefully I still have many years ahead of me. But, I think back to these people, there's been a lot of progress through the years, and I'm sure that there will be. There's a lot of research being done, and so they keep coming up with more stuff. But people have to advocate for themselves as well, and the providers need to just be aware. Like this is an education disease. This isn't like, okay, this is the only medication that can help you, whatever. This is an education disease.
Right.
And so people need to be like the doctor didn't, because I was a nurse, he didn't say, you really should go to the diabetic educator. I had to figure that out on my own. Like he still
right,
should
which
have
is correct. That's the problem, right? He made an assumption, right? And you just want to be a patient, and you want someone to coach you or advise you, and instead you had to kind of work for it yourself. And if that's what he's doing, what the endocrinologist is doing for other patients, they may not be as savvy as you in getting what you need, right?
Correct.
That's the problem. Yeah.
Yeah.
That's one of the problems, I should say.
So
I like the comment, this is an education disease. So what would you say to other providers as now experiencing kind of the journey of a newly diagnosed diabetic? What would you like to say as a patient to those providers?
I think pretty much the same thing too, that I am, I don't know anything. This may be what you do every day, but I know nothing.
Okay.
And so you need to guide me. You need to talk to me. Don't just give me, I walked out of there with a pile of papers or, 15-gram carb foods and, whatever. But I need the education, the support. I need the information.
Right.
Because again, there's a lot of Dr. Google people who are just going to go and try to find it themselves and may or may not get accurate information. But there are some people who won't, and they I didn't know. They don't know. So like providers of they really need to go to provide education to patients. Because
and
people
to know
don't know
that,
the right.
Well, and to know that there are groups and classes, diabetic educators out there, and that there are perhaps online groups, that there are resources that patients can tap into that will help that education at whatever level it is. Was the diabetic education class covered by insurance?
It was covered as under the nurse practitioner, who's covered under the doctor,
who's covered under the health facility, who's covered.
Right.
Okay.
Right. Yeah, there's a lot of, and that's and that the other that you brought that up. There are, and this is going with a lot of the type 2s as well. The continuous glucose monitors that people see with the little disc on people's arms and so on are amazing in helping people to regulate themselves and know. Routinely diabetes, it was test your blood sugar, stick your finger before you eat and before you go to bed. But you didn't know what was going on in between. And now we have the ability to know exactly what's going on in between, what you're spiking to with your food. Like you spike after 2 hours after you eat, you could be really high, but you're not testing again until the next time you eat. So it went, but a lot of the insurance won't cover it for type 2 diabetics or for anyone who's not on insulin, actually, is what the regulation seems to be. So you're now putting these people who could be better controlled, which would help to save down the line the catastrophic cardiovascular disease, peripheral vascular disease and all those things, could be better controlled because the insurance company won't pay for this little tool, which could help to put a whole different spin on it. So unfortunately, we're all a little bit victims of that as well.
Well, it's as often with the health insurance coverage, it's penny wise, pound foolish, because to your point, if they could better control, then they would have less complications. Therefore, less expense. It doesn't,
right.
Exactly. But I wish everybody could be as motivated as you. So kudos to you for jumping on it. I'm glad that you're feeling better.
Yeah. Thank you.
Is there anything else that you would like to add? You are certainly a wealth of information now that you're a new patient.
Thank you. Well, the only other thing, and is that I think, and I would say this to the providers as well, is, there's a psychological piece to any real disease. And again, I have support of, I go out to eat, and, everyone knows I'm going to whip out my pump and try to figure out how many carbs I have the bolus for and stuff like that. And I have a lot of support. But like I said before, some days I'm just like, I can't wrap my head around this, that this is going to be my life forever.
Right.
So just people, the providers need to be aware of the psychological pieces of some of these diagnoses as well. And people, again, I having worked as a nurse with diabetics, I did not know anything about LADA or type 1.5 until I was diagnosed.
Right.
And so people don't know to ask the questions, but it's really what I was really started there was that to also be aware and get the support for the psychological part of it, and how to absorb it into your lifestyle.
Is that, I don't want to put words in your mouth, but is that one of the more frustrating parts of this journey for you?
Yeah.
Yeah.
Yes.
Yeah. As it would be for anybody. I think last week, Crystal Chuck, one of our patients, talked about her experience at an academic medical center when they found out she had a rare cancer, that they were very excited about it, but she was suggesting that perhaps they mitigate some of their excitement because she was scared. Like I don't want to be, I think she said, I don't want to be a paper, right? I know you're really excited because you went to medical school and now you found this patient with rare cancer, but it's me. And I would like you to, try to understand that I'm scared. So, wait till I leave the room and then you can high five and talk about that. But I think that's, to your point earlier, this is your first time being diagnosed with diabetes. The endocrinologist has probably diagnosed thousands of patients, but it's your first time. And that matters.
Mm-hmm. Yeah. And came out of, came out of the blue, like you just don't expect. Again, I was really took for granted my good health and how lucky I was to really, go through life healthy.
Yeah. Well, listen, I mean, as we get older, that's one of the things I am most grateful for, is that, like you, I have good health, and we deal with patients every day who are faced with really challenging and life-threatening diagnoses. And so we understand as nurses how important it is to have good health. And I know it's a kind of a euphemism. Oh, if you don't have your health, you have nothing. But it's really true. It really is. Because you can't enjoy whatever else you have if you don't have your health. So,
correct.
On that note, I want to thank you for sharing your journey as a patient. It's not often that we do that as nurses. We do have our fair share of diagnoses that we have to deal with. So thank you for taking the time and for being so candid about your experience.
Well, thank you for inviting me, and I'm glad to be able to. If I can help out one other person, people can hear it, and maybe even some providers. It would be great to let them listen and understand. But I'm happy to share.
Thank you, Andrea. All right, have a good one, kiddo.
All right, thanks. You too, Betty.
Okay. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you found our conversation helpful, please share it with your friends and leave us a review. You can learn all about how Guardian Nurses helps patients and their families when they need it most at our website, guardiannurses.com. So until next time, find some joy in your life and pet all the good doggies and kitties, and remember to tell your people that you love them.